So in this video, we're going to be talking about shoulder dislocations. And as it says there, this is when the head of the humerus becomes separated from the scapula. So if you remember, the humerus is the arm bone, the scapula is your shoulder blade. They're going to become separated. And I'll show you some pictures on x-ray in just a minute. It can be partially dislocated, where it's only partially out of the socket, or it can be a total dislocation, right? Like it says there, total dislocation, the head of the humerus is completely out of the socket. It's always due to trauma when doing this. There may be tearing of ligaments and tendons that support the shoulder. And that's pretty common, that you may get tearing of the ligaments or tendons with this. And a doctor can put the shoulder back into its socket. It's called a closed reduction, and the pain stops immediately. And repeated episodes of dislocations can lead to shoulder instability and may require surgery to fix. So the reason being is because if you keep doing this over and over, you're going to have to stretch out those ligaments and tendons and the glenoid labrum to get, as the shoulder keeps popping out. And the more you do it, the more you wear those ligaments, tendons, and the glenoid labrum out. And so eventually they have to go in and do surgery on this. So let's go ahead and take a look at this. And if we take a look here, as you'll see, you have this ball sticking out here. Now, you don't always get this ball sticking out like this, but for the most part, this guy's humerus has come up and it's dislocated out this way. Now, this is looking at a normal shoulder on the x-ray. So this, once again, right here is the head of the humerus. That's coming up this way. And this is part of the scapula that goes this way. Okay, that's my acromion. And once again, I know I keep pointing this out on different videos, but there's my AC joint. So what you saw in the last one is that guy's, the head of his humerus went up this way, and that's why he had that bulge on his shoulder. You can get this dislocating down this way. It can go posterior. I don't know how to draw posterior, or it can come towards you. So it can dislocate in different ways. And we're going to look at an x-ray right now of a dislocation. So if you look here, if you remember back on the last one, there's an awful lot of space between this area up in here and down on the top of the head of humerus. The head of the humerus, this part right here, this is actually a pretty good x-ray. This part right here should be touching this part right here. So this has not only gone down, but it's gone this way. So it's also gone posterior. From the looks of it, it's like it's behind this part here, as you can see. So what you would need to do is pop this both. It would have to come towards you, and it would have to go up, just from the x-ray, just looking at what it is on the x-ray. And normally on the x-ray, it's hard to tell if something's anterior or posterior. Now, for this course, I would never recommend popping somebody's shoulder in, but I really like this video because of the fact that this guy has gone through this so many times that he knows exactly what to do. I'm hoping that the audio will work on this. If not, I'm going to pull this down. If not, just go ahead and look it up on YouTube. You can see it's only a 43-second video. You may notice on this, his hand's in the way, but you may notice how his shoulder's up right here. And like we said, once somebody gets treated for this, the pain just goes away. You're not going to jerk it. And you can see how it popped back in there. Okay, so here's another video of where they're going to go ahead and reset the guy's shoulder. Again, I would not recommend that you do this, but just to give you an idea of what you do. If you notice, they never jerk on it. It's just a gentle pull-in rotation motion. You rotate so you can get the head of the humerus moving back into position. And if you look, you can actually see the shoulder. If you look, watch the shoulder right here, and you can see it pop in. And then the pain is gone. So that's it for dislocated shoulder.